Hi. So I wanted to hop on here because I'm finally feeling back to myself after almost 2 weeks of being just kind of laid out with shingles. And I know that this is a site for women's health, and a lot of times I think people don't think that shingles would be attached to women's health. But I'm coming on, one, because I'm a 43-year-old woman and just came down with a pretty significant case. And two, because as a provider and practitioner, I've had quite a few cases of shingles in women around my age group and older, and some even younger, over the past few months. I think that it is directly related to the amount of stress, but I just wanted to hop on. This video is going to talk a little bit about some of the things that put us at greater risk. And then I'm going to do a video on some of the medications that may be beneficial if you do have shingles develop in your system, or if you know of someone, because I think that many of us may have a woman in our life that ends up with shingles. And so you can hopefully provide this as a resource for that loved one or person in your life. So about 2 weeks ago, I developed some pain behind my left arm, and I was thinking it was a muscle strain. And but then it started to feel a little funky, like burny. And as a clinician, you would think that I would have figured it out a little bit faster, but it took me a couple of days and the onset of a lesion in the back of my head for me to figure out, like, oh my goodness, I have shingles. Shingles is not something that you contract in terms of, like, I am not going to give shingles to somebody else. I would potentially pass on the virus to someone young who has not either been vaccinated or had chickenpox. So it really isn't something that is going to transmit in that manner, because it's a virus that lays dormant in our bodies unless, and what puts me at higher risk is that I am Caucasian, over the age of 40, and I've been under significant amounts of stress over the past, well, I don't know, what are we in, month 9, month 10? I've lost count. So most of the time it's a stress response, especially in women. So if you have been under significant amounts of stress, if you do develop a sort of a sensation anywhere in your body, generally it affects one nerve root. So that might be upper body, like it was with me, in the scalp, the shoulder, the upper back, or it can be in the lower back. Those are some more common locations. So if you do develop a symptom like that, I would strongly advise that you consider contacting your provider so that you can be diagnosed as immediately as possible, because we do know that if we can diagnose you within the first 48 to 72 hours, our chances of the medications working are much greater. And that's my main intention with this, is that please, 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 if you develop, it's very challenging to describe the sensation. I've been trying to figure out words to use to describe it, but it's really challenging. But it's basically just like a deep, deep burning and almost a nerve-like sensation that doesn't feel like it's in the muscle. It kind of feels like it's in between the muscle and the outside of your skin, is the best way that I can describe it. So that's a little bit on shingles in terms of how I have seen it impact women, and what placed myself personally at higher risk and what might place you at higher risk. And then I'm going to hop on here in just a minute and do a video on some of the prescriptive medications that we can use. And obviously with all of this, please contact your healthcare provider if you have those symptoms so we can help you.